permits a certified foot care nurse to provide certain at-home foot care, including routine foot care and nail care, including nail clipping. Senator Urso.
Thank you, Madam Chair. Today I'm very pleased to introduce Senate Bill 2116. This bill would amend Title V, Chapter 34 of the Rhode Island General Laws on nurses to permit a certified foot care nurse to provide at-home routine foot care for patients in need. This bill is about restoring dignity, it's about compassion, it's about preventative care, and it's about quality of life for disabled or older adults who wish to age in place and for whom a trip to the salon or the podiatrist is out of the question due to vision, orthopedic, mental health, or other conditions. This is a bill has bipartisan support in the Senate because we realize the need is great, and that is because at-home podiatrist visits have decreased, and many older adults are no longer able to safely provide this care for themselves. This is a self-pay service. We are not asking for insurance reimbursement for this care. And as such, we believe that Rhode Islanders should have the right to opt to pay for these services and to have them provided safely by a qualified nurse in the privacy of their own homes. The genesis of this bill came from a desperate phone call from a constituent whose homebound, disabled veteran husband was unable to find anyone to provide this care for himself. He did have the advantage at one time of having a certified foot care nurse providing this care until the Rhode Island Department of Health issued that nurse a cease and desist order because in Rhode Island, nurses are prohibited from providing this much-needed care. And I would ask, why are we prohibiting qualified nurses from providing care that Rhode Islanders need when in Massachusetts and in Connecticut, certified foot care nurses are practicing? They're practicing in other states in the country, other countries in the world, and have for years without incident. To achieve this certification, a nurse must demonstrate competency and advanced skill, and is trained to recognize complications and to provide the appropriate referrals when the treatment falls outside of their scope of practice. And to be clear, by routine foot care, we're talking about non-invasive, atraumatic maintenance of toenails and common uncomplicated corns and calluses. It's preventative care. It's non-surgical. It does not involve disruption of live tissue or any other surgical scenario. Now, I understand that podiatrists have reasonable concerns about the safe delivery of this care, about proper sterilization in the field, and that the appropriate referrals are made. And I did appreciate hearing Dr. Lepore's testimony to this effect in the House Health and Human Services Committee, and I'm happy to see that she is here this evening to provide this testimony to us. One thing I didn't understand was a comparison that was made between pedicurists and nurses. Pedicurists train for 300 to 600 hours over 3 to 4 months to perform basically cosmetic services. Nurses attend college at the associate's level for 2 years, at the bachelor's level for 4 years. They train in clinical practice. They study microbiology, they study anatomy and physiology, and to achieve this certification, they study an additional 30 hours under a podiatrist or a certified foot care specialist, and are, in my opinion, far more qualified and prepared than a pedicurist to safely provide these services. We also understand the Department of Health has concerns pertaining to training of certified foot care nurses, how they're credentialed, that they're properly certified. And of course, they are concerned that they will have to promulgate regulations to permit this. But these concerns should not preclude our making these services available by qualified nurses who can deliver them safely. And I personally feel that once we allow nurses to provide these services, it will come as somewhat of a relief to podiatrists, because we will have better preventative care and ultimately overall better health outcomes in our state. I appreciate you hearing this bill, Madam Chair. I ask my colleagues for their consideration, and I look forward to the testimony. And I would like to thank all of the individuals, state agencies, nonprofits who submitted letters of support on this bill. Thank you.